Hi, I'm Dr. Lucy Hale. I'm one of the veterinarians here at Wellesley Animal Hospital. This is Foster. Foster is an adult male bearded dragon. He's here to help us decide when to bring your reptiles to the vets and what to look for at home to see if they need to come see us. Foster's watching me intently. He is keeping an eye on what is going on and being nice and alert. We're looking to make sure they are using all 4 of their legs evenly and they are moving around normally in the cage. And we're looking at their skin and looking at their shed. We can see Foster here starting to shed on his head. You can see the change in coloration, and we want to make sure we're looking at all parts of them, all the way to the tip of their tail. Bearded dragons can get problems shedding right at the distal tip of their tail here, and so make sure that there's not any discoloration there and it's not going black at all. When it comes to their eating, bearded dragons are omnivores, so they eat insects and vegetables and fruits and flowers. So be sure to give them a variety the whole way throughout life. As they get older, they need more of the vegetables and a little bit of fruits and less of the insects. As they are younger, they need more of the insects. Keep an eye on their eating and are they pooping normally at home. Adult bearded dragons might not eat every day. And a good way to see if they are still doing okay is to monitor their weight at home. The reason bearded dragons have their name, this is their little beard area here, and it actually goes when they are upset or angry or scared. It actually goes very black and it makes them look very scary. They don't like to be housed together, so make sure you have them housed alone. Looking at their bones are very important for reptiles. They commonly have problems with bone density, and that leads them to very commonly get fractures from even the simplest bit of trauma. So if they've had any trauma or any falls, don't hesitate to bring them to us. A way to make sure they have good bone density at home, you must always have, for bearded dragons, a UVB light. And this is so they can get the vitamin D from the light and then allow them to absorb calcium for their bone strength. UVB lights tend to drop off around the 6-month mark. So I would always mark in your calendar 6 months from when you put the UVB bulb in to make sure you get them another one at that point so that they are still getting the vitamin D they need. This is little Mikey. Mikey is an adult male leopard gecko. Mikey is looking around as I'm moving him, looking to see what is going on, and he is nice and alert. We're looking at their eyes to make sure they are both open and nice and bright with no shed within them. We're also looking for any nasal discharge or any difficulty breathing. He's quite happy sat here on my hand. Reptiles like to have floor underneath them and like to have all their 4 feet kind of grounded, even if that is on your hand as opposed to a table. So whenever you're picking them up, make sure that they always feel like they have floor underneath them. He's using all his legs. He is not favoring one over another, and he's not putting any in abnormal positions. He has a nice fat tail. For leopard geckos, that is where they store their fat. So it is good that he has this storage of fat there to see that he's in good body condition. We want to make sure that he is eating a healthy diet. Mikey here is an insectivore, which means he likes to eat insects. And the bigger variety of insects you can give him, the better, to make sure he gets different nutrients from them. Other things we look for is any change in their stool production or their drop-ins. So if you're noticing that they're not having any drop-ins, or if they are having what looks to be softer drop-ins or diarrhea, if you are concerned at all by your reptiles, never hesitate to give us a call. We are always more than happy to answer your questions and to help assess how urgent the problem might be. When we want to bring them along to the vet, a little reptile like Mikey here will very easily come to us in a Tupperware container, so it's easy for any of you at home to make as well. This is one that Mikey comes in. It has holes in the top for airflow, and he's nice and secure to come to the vet. We want to make sure we keep the car a little bit warmer than usual. We don't want to blast the air conditioning at all, and we also don't want to blast the music. We don't want to stress him out, especially if they're sick. We want to make sure they don't have a stressful journey to us. Now, one of the most important things to do with your reptile is annual wellness visits. And the reason we recommend these is to make sure that your reptile is healthy, as they do not always show signs of illness like our cats and dogs do. Or any of your veterinary visits, we do recommend that you bring pictures of your cage setup as well as pictures of any supplements, or you can bring the supplements and food along as well, so we can assess all aspects of your reptile's care. A lot of problems in reptiles are husbandry related, and we want to make sure that we are doing the absolute best for your reptile to keep them healthy and to help prevent disease.